Hi, I'm Katie Keegan. I'm the Program Director for the Medical Genetics Residency Program at Michigan Medicine, and I'm going to tell you a little bit about our program. So first of all, I'm going to talk a little bit about our program leadership. I'm the Program Director. As I said, my name's Katie Keegan, and on the right is our Program Coordinator, Cindy Dreffs. Both of our email addresses are listed, and so if you have any questions, please feel free to reach out to us. And first, I want to talk a little bit about our how important diversity, equity, and inclusion is to us. Our training program really values a diverse community, and we welcome individuals with differing life experiences and points of view. And finally, we strive to foster an inclusive environment for our training program. I'm going to talk a little bit about the curriculum, and that includes our clinical rotations, laboratory rotations, research and scholarly activity, our didactic curriculum, conferences, and our outreach clinics. So first of all, our clinical rotations consist of several different rotations, including pediatric and biochemical genetics, adult genetics, cancer genetics, prenatal genetics, and adult neurogenetics. We operate on a system of 13 four-week blocks, and for pediatric and biochemical genetics, we have 13 of those blocks, and I am the director for that rotation. For the adult genetics clinic, there are 6 blocks, and Wendy Ullman is the director of that rotation. For cancer genetics, Elena Stoffel directs that rotation. It's a 4-block rotation and often occurs concurrently with the adult genetics rotation. And then the prenatal genetics rotation is 1 block and is directed by Marcy Treadwell in OBGYN. And the adult neurogenetics rotation is directed by John Fink in neurology. We have 2-week laboratory rotations in biochemical genetics, directed by Shane Quinones, in molecular genetics, which is directed by Marwan Teya, and in cytogenetics, directed by Lena Shao. These are all conveniently located in Ann Arbor, and during your laboratory rotations, there is no clinic or call responsibilities, which allows you to focus on learning the laboratory setting and what goes on in those different laboratories. In terms of research and scholarly activities, we have an individualized research curriculum, which is 6 months or 6 blocks. There are multiple different opportunities that are available to you at Michigan Medicine, even in the Department of Human Genetics or other basic science departments. There are also opportunities within the School of Public Health here. And there are opportunities in basic science or clinical or translational science as well. And this research block can be tailored to your interests. In terms of didactics and conferences, we have the Human Genetics graduate course, which is flexible for those with a PhD in genetics or a related field. And in that case, there are other courses that are available to you through the Department of Human Genetics based on your interests. We have a biochemical genetics weekly didactic session. Some of you will probably see this didactic session during your interviews. We also have laboratory sign-out teaching sessions. We have a clinical genetics journal club on Mondays. And then on Fridays, we have our post-clinic conference where we talk about the most interesting patients that we saw that week. And then finally, we have a monthly medical genetics grand rounds, which is for more formal presentations that are given by trainees and other faculty members. In addition, we have our outreach clinics. Those are located in Marquette, Michigan in the Upper Peninsula, and in Traverse City, Michigan, which is in the northern Lower Peninsula. I know that our trainees really value their experiences in these clinics. They're a lot of fun, they're a really great bonding experience, and they're also located in really beautiful settings. In terms of our schedule, so this is an example of the categorical program schedule. And typically, residents would rotate through pediatric and biochemical genetics for their first 6 months or so, and their laboratory rotations would be included in there somewhere during those months. And then the second half of that year is usually adult and cancer genetics, which would run concurrently. And then in the second year, there would be the month of prenatal somewhere in there. As well as more pediatric and biochemical genetics. And then typically the last 6 months would be the individualized curriculum or research activities. For the combined program, the schedule is shown here, and the intern year would be all pediatrics rotations. So you wouldn't start on genetics until the second year of the program. Starting in the second year, you would have pediatric and biochemical genetics to start out for the first few months and then get some adult and cancer experience. And then you rotate back and forth from genetics to general pediatrics rotations. In the third year, there's a little more pediatric genetics and as well as more adult and cancer genetics. And then finally, in the fourth year, for the genetics rotations, we have you finish up with pediatric and biochemical genetics to really reinforce that before you would do your individualized curriculum and research activities. In terms of our logbook and the ABMGG exam, I just want to point out that our trainees never have any problem getting the required number of cases for their logbooks. And we also have a 100% pass rate for the ABMGG exam. And then finally, we are accredited by ACGME. And this is just to show you the people that are involved in the program, because that's a really important part of the program. So we have our pediatric and biochemical genetics faculty here, and there are 9 different faculty members who see patients in our pediatric and biochemical genetics clinics. These are the folks that are that see patients in our adult genetics and cancer genetics clinic, and there are a couple of our pediatric faculty who are also involved in the adult genetics clinic. And then these are our current medical genetics trainees. So we have Christina Sloan-Hagen, who is a third-year combined resident. We have Tony Scott, who is a second-year categorical resident. We have Zachary Witt, who is a second-year combined peds and medical genetics resident. And then we have Kristen Lee, who is our current medical biochemical genetics fellow. And here we have all of our pediatric genetic counselors. This is an awesome group who we will work with closely at our program. And then finally, here is our incredible administrative staff on the left, and on the right, our metabolic dietitian, Sue Lipinski. And then finally, these are the people who work really hard in the lab, both in the biochemical and molecular genetics labs. And so finally, I'd just like to thank you for your interest in our program. I hope that you enjoy your interview, and if you have any further questions, please feel free to reach out to me, and I will be talking with all of you at some point. Okay, thanks again.